Yes, we are going to have role play sessions, individual sessions. Okay, individual sessions. So all of you can enjoy this session. Okay, you can learn from others. These will be recorded and the script will be given to you. Yeah. So, right. So those who are interested for this session, yes, you can participate. Yeah. So first, in order, Avil Narona, are you ready for the speaking session? Number one, according to the admission to the session, I am calling you Avil Kenwith. Are you ready? You can message me. And those who are ready can write your name and say ready. So, for example, you can say like this. Number one, Avil Kenwith. Then you can say ready. Okay. There you can say video or audio. Any one you can write. So because we are going to do individual sessions one after another. So you can get ready. So like that. Avil, if you are ready, write number one, Avil Kenwith ready. Or just write your name, Avil Kenwith, and say ready. Yeah. Avil Kenwith is ready. So Avil, be ready. You have already given me a video. Very good. Very good. So I hope you have the card in front of you. Yes. Yeah. If you have the card, you can keep it with you. Or let this card be like this. Yeah. So number one, Avil Kenwith. So confirmed. Number one is Avil Kenwith. So who is this FA? So write your first and second names, please. Okay. Write your first and second names, please. So for doctors and nurses, we are taking the session. Yeah. If you are a doctor, you talk like a doctor. And if you're a nurse, you work as a nurse. Yeah, get ready. So all of you can prepare this card. Yes. I will can with you have 3 minutes to prepare. Yes, good evening, Shabnam. 1 second. Let me take current page. Wait. Yeah. So those who are interested for participation, you can give your names one by one. I'm joining to check your things, how it is going on. Okay. Right. Yes. Yes, card is blurred. How come card is blurred? Okay. Yeah, you can rejoin. Yes. Yeah, I will Kenwith. You can start your audio. I will Kenwith. You can unmute. Yes, and you can start your
Hello, sir.
videos. You can start your video and say yes. Right. Yeah. Yes. Yes. Once you are ready, you can start. I will.
Yes.
Once you are ready, you can start.
Yes. Okay, sir. Can I start, sir?
Yes, of course.
Okay. Good afternoon.
Good afternoon, nurse.
I'm Avil, one of the registered nurses working in this hospital. For the verification purpose, could you please provide me your name, age, and purpose of your appointment?
My name is Peter, and I am 60 years old, and I have come regarding my insulin injections. The doctor has suggested me, so I came for
Okay.
counseling regarding this.
Okay, thank you for providing valuable information, Mr. Peter. And would you mind explaining me your concerns regarding commencing the insulin injections?
Yeah, actually, nurse, I, in the first place, do not know why the doctor suggested me to go and take insulin injections because I'm doing well for the last 3 to 4 years with my diabetes diet, medication regimen, and exercise program. What makes the difference?
Yes, I can really understand your feeling because with your current with your diet and your previous medications, now blood sugar is not controlling. So after considering all the pros and cons, and the doctor has considered the insulin injection are the best option for you. So are you clear with my point?
I want to tell you something personal. I am a bit anxious, and I'm not sure about starting insulin
Okay.
injections.
Yes, there is a that's a valid question from your part. So could you tell me what's bothering you actually? Like, are you bothering about injection procedure, or do you have any fear of needles?
Yeah, partly you're right. Since my childhood, I'm scared of taking insulin injections. I don't really like the thought of injecting myself. How can I do that? I don't think I can be able to do it.
Yes, I can really understand your situation, but like most of the people are telling the same thing. Now they're managing their diabetes well. So I have seen in my professional experience many people like now they're leading a good life with injecting their self. So if they are doing means you can also do. So do not worry. I'm here to help you. So finally, I'll demonstrate what you can do at home. So is that clear with you?
Yeah, but before proceeding further, I want to ask you one question. Is there no other way to manage my diabetes without these injections?
Yes, that's a genuine question from your part. As I mentioned earlier, the viable option for you is now to take insulin injections because the doctor has already, seen your condition and he has seen all pros and cons. So after considering that, so you have left only insulin injections. So that's good to take, Mr. Peter.
All right, I understand. All the information that you have given is very clear. Can you please explain me?
Yeah, you can manage these injections with the clear instruction and, with the easier practice. So we will provide that. And also there are some importance to take the insulin injections. So first of all, it will faster absorb into the bloodstream, and also it will not broke down in the stomach, and also it is more effective than your diet or oral medications. Are you with me?
Yeah, of course, nurse. That's very clear. Can you explain me further?
Yes, let me explain you the injection giving procedure so that you will get some idea about the insulin injections. So it is very imperative to wash and dry your hands before proceeding the injection. And also you may pinch the skin, and following that you can insert the needle into 45 to 90-degree angle. And following that you can leave in place for 5 to 10 minutes, because uh, it will absorb correctly. And also it is very imperative to rotate the injection site, because to prevent formation of lumps, and the risk will be less while absorbing. So is that clear with you?
Yeah, nurse.
Okay, do you have
Can
any
you
other
tell me
concerns
whether I
regarding
can
this?
use the syringes? I can use the syringes, the same syringe every day, or should I substitute with a new one?
Yes, regarding the insulin injection and all of this information, we will provide you a leaflet, and also we will give health education regarding this, so that you will get a better picture, and we will also demonstrate at the end, so that you can ask me at any time, like afterwards. So I'll explain you in detail. So is that clear with you?
Yeah, of course, nurse. That's very clear.
Okay,
I understand. And I feel better about the
okay.
injections now, and I'm ready for you to watch me give myself an injection.
Okay, and most importantly, Mr. Peter, and I'm going to tell you regarding the needle disposal. So there are some suitable containers which after taking injection you can dispose there, and also you can take proper care and handling about that. And also let me explain you regarding the storage of insulin. You can use in the refrigerator unopened insulin, and also it is very imperative to not expose to the light and heavy temperature. And most importantly, you can check the expiry dates. It's really important. I
Yeah,
hope you are with me.
that's fine, nurse. And what if the container is filled? Then what am I supposed to do?
Yeah, there is nothing to be alarmed about, Mr. Peter. When the container is two-third full, our member will come and they will take back, and you will be given new one.
Yeah,
Is that clear to you?
yeah, of course, nurse. That's absolutely clear. And yes,
Okay. Okay. Now I'd like to obtain your consent to commence the insulin injection. Shall I proceed with that?
yeah, of course, nurse.
Okay, Mister. And I hope, I strongly believe that I have given you the relevant information, necessary guidelines, and appropriate measures to the best of my knowledge, wisdom, and experience. If you have any further concerns, please do not hesitate to ask me. I am here to help you at any time.
Yeah, thank you very much, nurse.
Okay. Okay. Thank you for patiently listening to me. I wish you a speedy recovery. Thank you.
Thank you once again. Yeah, now coming to your speaking session, Mr. Avil Kenwith. Okay, let me give you some points. I cannot give you everything related to your speaking because there are many points which I have to discuss, but I will discuss only three main points because for each and every student, you can mute your uh, mic now, and your video also you can stop. So that's it. Now let me give you the feedback regarding what your speaking session. Okay, first thing is there is something called mannerisms. Mannerisms. Mannerisms, you have your own mannerisms and I have my own mannerisms. It's my style of speaking. You have some mannerism. These mannerisms I have noted down, and there are two as of now. Two mannerisms I have noted. First mannerism is, you know, you know, you know. So you have used this one 3 times. That means thrice. The phrase, you know, you have used it 3 times. This is a self-defeating phrase. If I know, then why are you telling me? And when you say you know, that means I already know. So there is no need to tell about that. So instead, avoid saying you know, because you are caught here. So just to speak like that. Next one is, the second one is well. Well. This you have used 2 times. Why well? Instead of second time well, you can say okay, or that's fine. That's absolutely reasonable. So something else you could have used. Right. Now next one. Instead of you know, you can say generally speaking. It's a well-known fact that. So something else you can use rather than these mannerisms. Avoid these mannerisms. Mannerisms are habitual actions. Mannerisms means your manner, your style, your your way or your approach or your attitude, whatever, your style. Okay, that is called mannerism. That means you have a habit of these tendencies. Now here, when you have a mannerism, you tend to repeat them by default. So there is another part coming out there that is called repetition. A repetition factor. That means you are repeating these things unknowingly because it's a part and part. It's there in your blood. It's there in your habit. It's a habitual action for you. You don't even know that it is your mannerism. You just tend to repeat these things. So avoid mannerism so that that repetition will not happen. Next, avoid repetition. That's it. Avoid mannerisms as far as possible. Next, number 3, unnecessary sounds. Like this. Here, you can stop your mouth. You can purse your lips or zip your mouth tightly. When you're not ready, it shows that you're not ready. It shows that you're not ready. These sounds are called meaningless or purposeless. They're termed as meaningless or purposeless because they happen unknowingly. You don't even know that you are making these sounds. Just want to speak something and you open your mouth and you speak something. You want to speak something and the subject is not ready, and then sound comes and you cannot control that. Mouth is already open. So avoid opening your mouth when you're not ready. 1, 2, or 3 seconds a delay is not any problem. When I am stopping for 1, 2, 3 seconds, I'm creating an impact on the audience. So that means I'm going to say something. Wait, that's the meaning. You're creating an impact, and if that to a strong impact. But when you open your mouth and say, you're confusing the person who is in front of you. Instead of that one, you can say, oh, That means, is that so? Or you can say, yes. Okay. Next. After that, first and foremost, last but not least, on the other hand, in contrast, you can use these phrases initially, firstly, after that, or next, or secondly, thirdly. The third point is, the fourth option is, and finally. So you can use these instead. Write down these. These can use this. These can serve the purpose of fillers. When you don't have anything to speak, you can use these words. In the first place, let us discuss about the sites where you can take the injection. Firstly, you have the two shoulders. Secondly, the thighs. And last but not least, the area surrounding the belly button. These three locations are the most preferred sites, or the best sites to take these insulin injections. And remember, never take insulin injections on the same site time and again. You can rotate these sites. First the right shoulder and then the left. Next the right thigh and then the left. And finally, the area around the belly button. And you can repeat the same order. And make note in your diary so that you will not take the same. To avoid bruising or creation of lumps. So this is the way how you can speak. Firstly, secondly, last but not least. So here you are using some sort of quality and connectivity. So these are some points. Yeah. Now next one is, you used one sentence. It will not broke down. It will not broke down. When will is there, you should use a V1, but unfortunately, you used a V2. It will not break down. It will not break down, but you used the broke. It will not broke down. This is a grammatical error. Avoid such grammatical errors. Be careful. Will always be used with V1, not V2. Remember that. V3 can be taken, but it is in the passive voice. It will not be broken down. Passive voice. It cannot be broken down. Break, broke, broken. You have to remember that. Will take V1, not V2, especially in the active voice. And in the passive voice, V3 will be there. Next, it is very imperative. It is very imperative that. Very good phrase. But why did you use it a second time? Did you forget that you already used this one? Don't you have any other alternative for this? Instead of imperative, you can use compulsory or beneficial. Something else you could have used. These 4 words, it is very imperative. All the 4 words you used again. So it shows that repetition of words, phrases, and clauses prove that you are incapable of using an alternative version. You are caught and you are giving a message that I cannot use any other substitute for this, and I know only this. That means you cannot exhibit variation in your speaking style. That's it. So first thing is avoid mannerisms. Second thing is avoid repetitions. Okay. And third one is avoid unnecessary sounds. Yeah, that's fine. Next, who is the next one? Anybody else? Is there anyone else who registered your name? Yeah. Sir, please repeat. What I should repeat? I have told number of things. Simiat Abdul Rahim. Yeah. So number 1, that is Avil Kenwith, finished his speaking session. There are 10 more students who wants to have the next session. Yes, who wants to have the next session? Write your name and say ready. Write your name and say ready. So I'll unmute your mic. And you have to say video or audio only. Yeah. Because when you see your video, you can correct your styles. So whoever is ready, write your name, number 2, and your name, and then say ready, and then say video or audio. Anyone? Anyone? Yeah. Please. Nobody? So we have, yeah, doctors also. If doctor is there, I'll give you doctor's card. No problem for that. The discussion is already recorded by a Siemens Autopilot. It's already there, my assistant artificial intelligence there. So it is typing everything which you are doing. And afterwards, I'll give you your dialogue. And you can check and we can correct that. Yeah, who is the next one? Yeah. Number 2, Simiat, ready, video. Awesome. Awesome. Thank you very much. Be bold enough. If you say audio also, I'm okay for that. But be bold enough. If you cannot face me here, you cannot face the interlocutor there. You will be feeling shy. You will be feeling scared. and you will be feeling tensed. When you are doing an online session, if you are bold enough, then you can definitely face or encounter the interlocutor in the real situation or scenario. So thank you, Simia, for being bold. Yes, I am opening your mic and you can start your video. So others who want to speak, you can be ready, prepare the card, and those who want, everything is on the YouTube. If you are not ready for YouTube, then don't ask now, because I'll call you personally on WhatsApp video. I'll take personally. That is different. But be bold enough. Whatever your request will be heeded. Yes, Simiyat, unmute, please. You can unmute, Simiyat. Yes, that's fine. Yeah. So get ready for your session. Once you are ready, you can start. The next candidate is Simiyat Abdul Rahim. Others, you can follow the others' speaking styles and you can learn many things. Yeah. Once you are ready, you can start, Simiyat. Yes, you are muted. Okay. Simiyat. Yeah, you can unmute. Yes.
All right. Good afternoon.
Good afternoon, nurse.
How may I address you, please?
You can call me Martha, and I am 60 years old, and I have come to know about this something called insulin injections, which the doctor has recommended me. And can you please tell me regarding this?
Okay. I can see from the doctor's prescription that he has commenced you on insulin, and I hope he has informed you this earlier. Is that all right?
My big question to you, nurse, is why this doctor is trying to change my treatment plan? I am well and happy with my previous program, my diabetes diet, medication regimen, and exercise program. Why did he tell me to change in the first place? Can you give me the valid reason for that?
Well, Mr. Mata, I can feel your concern, but the reason is that the sugar level has not been controlled recently. So, but to achieve this, that is why he commends you on insulin injection. Insulin injection works faster than the oral medication you're on before. And due to the fact that it's not been controlled of recent, that is why he's placing you on insulin. Sorry if this inconveniences you, but that is that is the new prescription for you.
Actually, I am a bit nervous and anxious, and I'm unsure about commencing insulin injections. How is that possible? I am a common man and I do not belong to the medical background. And how do you expect me to self inject insulin in the first place?
Oh, yes, I understand. It's not easy for someone to start pricking himself with a needle. But as I've said earlier, that this is what will be of more benefit for you. So, but with practice, you will know how to do this and will achieve our aim. So practically, with practice, you will be able to inject yourself. This is the reason why you are here. So I will teach you more about how to go about it. Are you with me?
Yeah, of course, nurse. I understand what you're telling. But the thing is, I just don't really like the thought of injecting myself. I don't think I can manage it at all.
Mr. Mata, to be candid, you will be able to manage. It's just a matter of time. It's just a matter of time. With after observing and following my suit explanation, you'll be able to give yourself this injection. And if you may permit me, may I explain further how to give this to you?
Yeah, but you have my permission later for explaining these things. But tell me one doubt I have. Is there no other way to manage my diabetes? Is this the only option for me in this condition?
Oh, well, Mr. Mata, I'm sorry to inform you that there is no other option than the insulin injection, as it works faster for your present condition. I actually understand how you feel. So you have to bear with us and go with the recent changes, for it will be of more importance and beneficial to you. So you have to
Yeah,
comply.
nurse, I understand. The information is very clear, and I see the need and importance of these injections. So, would you mind explaining me the procedure and what all this involves in detail so that I can understand in a step-by-step procedure?
Thank you for permitting me to give you the breakdown of how to administer insulin injection. So firstly, you will start by washing your hands and drying it. Then you will proceed by pinching your skin, followed by inserting the needle at 45 to 90-degree angle, leaving it in place for 5 to 10 seconds. So, and subsequently, you'll be rotating the injection site to prevent formation of callus and also allow absorption of insulin. With this, if you keep rotating it, there will be less risks of callus formation, and you also not feel much pain from it. So that is the basic explanation on how to give the insulin injection. Hope you are following me.
Yeah, now I want some information regarding which sites I can take these injections, and then can I reuse the same needle time and again, or I should take a new needle every other day?
Yes, on each administration, you have to go with a new needle. You go with a new needle and ensure that you handle it with care. Then you dispose it in a container, which will also be given to you to prevent contamination, to prevent you injuring yourself and others. So it is actually the insulin injection will be stored in the refrigerator, which would not be open nor exposed to sunlight. So, and you actually check the expiring date to ensure that it has not expired. With the information, you'll be able to do well as expected.
Yeah, that's
Thank
fine,
you, Mr.
nurse.
Mata.
That's fine, but are there any ongoing problems or after effects or side effects of these injections, insulin injections?
Insulin does not have any side effects, just that we will also advise you to make sure that you have your food ready after administration of insulin, because if you don't have available food, it might also reduce it drastically beyond the limit we expect. So these are also part of the risks and side effects that follows insulin administration. As I've said earlier, that due to the high calorie, high blood sugar you're having, so what we have in place to ensure the sugar is being reduced is the insulin injection. So, which can bring it down drastically. So, but with the information, if well followed, you are safe. Do you need any more clarification, or you are fine with my explanation?
Thank you very much, nurse. You have given a lot of information, and I have no doubts regarding that now, and I'm ready for self-injecting insulin. And I want you to monitor me and be with me for 4 or 5 days until I am confident with this procedure.
Oh, on that, you don't have problem. I will do as you want. Thank you, Mr. Mata. Thanks for complying, and I wish you quick recovery.
Thank you very much, nurse. Right. Fine, that's very good. Now you can mute your audio and you can stop your video because I'm going to give you feedback. Simiat Abdul Rahim from Nigeria. Simiat, you said you, and a break of 3 seconds, again you, and then continued. That's a repetition. You're not ready. You said you, and you got stuck. And you forgot that you have already told you. And again, you repeated you and continued with that. That is a repetition. Fine. Next, it's just a matter of time. 3-4 seconds later, you repeated the same clause. It's just a matter of time. What is the benefit of this repetition? It is just a matter of time. 7 words you repeated. Why did you do that? Is there any practical benefit of repeating the same clause again? There is nothing. So avoid a repetition. Next, there are some pauses and breaks. That's fine. No problem. But the pauses and breaks should not be very long. Maximum 3 seconds. And you can start again. Do not extend the length beyond the 3 seconds because the connectivity will be lost. The fluency will be lost. The momentum of the listener to catch your ideas will be lost. The thread will be broken. So don't stretch beyond the 3 seconds. And then the Mr. Martha. So if you have any confusion, you can ask in the beginning itself. Martha is a feminine gender. If you have any doubt, you can ask before you start. So Martha is a feminine gender. So Mr. Martha or Mrs. Martha or Miss Martha, you can clarify, ask for clarification. So 60 years old, right? You can ask for clarification and you can use. And again, using Mr. Martha or Mrs. Martha, or whatever it is. Don't use number of times the name of the patient. What do you intend to communicate to me? That my name is Mrs. Martha? There is no meaning. There is no need. I know my name, right? My name is Martha and I am Mrs. Martha. I know that. Why are you using this Mrs. Martha 2-3 times? I know my name and you also know my name. Do you want me to know that you know my name? No. Are you creating a closer relationship with me? A friendly attitude with me? There is no friendly attitude here. This is a professional attitude. It's a formal style. Personal things put apart. Put them away. Personal things will not come. It's not informal speaking session. It's a formal speaking session between a nurse and a patient. Personal names and personal things will not matter. The subject that you are talking matters the most. Remember that. This Mrs. Martha, I told you so that you will know that I am the right person you are speaking to confirm that you are dealing with the appropriate person and delivering the relevant message. That's it. That's it. Once you confirm that I am Mrs. Martha, that's enough. Only 2 people are there on the stage. You on the other side and I on this side. Only you and I. There is no third person. If there is a third person, you can say, yeah, Mr. John, take care of Mrs. Martha. And now Mrs. Martha. So Mrs. Martha is required again to shift from one person to another person. When the shifting is going on to attract the person and to make him listen to you, then you will tell, yes, you, Martha. Yeah, Mr. John, take care of Miss Martha. And Martha, if you have any doubt, take the help of Mr. John. So when there's another person involved, of course, you can use the name. But you know that there are only two persons, you on that side and I on this side. So avoid that one and focus mainly on the subject. Subject. Remember, this is formal speaking session. Pauses and breaks. Do not extend the break or pause for more than 3 seconds. Yeah, I have given you 4 or 5 points. That's all for now. And then the next candidate. Next candidate. Anybody else? Yeah. Who is next? 2 candidates done. Yes, you're welcome, Simiat. And next, who is going to come for the third? Yes, you can message there. Your name, ready, audio or video. Name, ready, audio or video. And remember, this will be there in the YouTube. If you do not want your role play in the YouTube, then don't give your name now. You can come for personal session. Yeah, I'm waiting. I am waiting. I'll wait for 3 more minutes. Afterwards, I'll convert this into practice session. This is individual role plays. These are individual role play sessions, and I'll make you write. If you cannot speak, then at least writing session we can make it, right? Yeah. Yeah, we have Anita Pachigola, Deepika Chandigarh, Hafsa Fatima, Imma is a guest, Srija Ravindran, Sudha Rani, and Vinita Mold, Vinita Ramakrishna. Anybody? If you are not courageous, if you are not ready, then how can you practice? Okay. How can you practice? Attack is the name of the game. Attack. Don't be passive, be active. Don't be passive, be active. those whoever is speaking, they will get the script. Yes, 10. Now let me ask individually once again. Deepika Chandigarh. Deepika Chandigarh. Yes. Are you ready for a speaking session? Yes. Anybody? Okay, no problem. Okay, somebody has written there. Deepika, just give me 10 minutes. I believe that you can do. That's why I asked you. Okay, 10 minutes. Okay, take your turn. Yeah. In the meantime, anybody else? Anybody else? Hafsa Fatima, Geeta Jayakumar, Hafsa Fatima, Geeta Jayakumar. Yeah. Okay. So we have 10 minutes. In this 10 minutes, what we'll do is, yeah, Geeta Jayakumar, are you ready? Then say ready. Yeah, ready. Video or audio, your wish. If you are bold enough, video. You're not bold enough, audio. Whatever it is your wish. Yeah, that's fine. Can we start now? Next next one is Deepika. Be ready. Next is your turn. Yeah. So Geeta Jayakumar. Number 3 is Geeta Jayakumar. Yeah, Geeta Jayakumar, you can unmute your audio. Yeah, see
Hi,
that
sir.
there is no background disturbance. Yes, very good. Now, once
Okay.
you are ready, you can start. Yeah. Once you are ready, you can start. Candidate number 3. Geeta J. Kumar. Are you ready?
Yes, sir.
Yes, then you can start now.
Okay, sir. Good evening. I'm Geeta, one of the registered nurses working in this clinic. Before starting our conversation, let me know your name and age.
My name is Johnson and I'm 60 years old, and I have come here to learn about self-injecting insulin.
Yes, for the confirmation, your name is Johnson, 60 years old. Today you got an appointment for self-administering injection for diabetes. Am I right?
You're absolutely right, nurse.
Okay, thank you for the confirmation, Mr. Johnson. Could you tell me about your past history of diabetes? Means when is the onset and from how long you're taking the oral medication?
It has been 3 years, I think, since 2020 August.
Oh, okay. And by seeing your report, I can really appreciate you for maintaining your diabetes mellitus with your diet and oral medication, Mr. Johnson. But recent research shows that your blood sugar level is high. So doctor has decided to commence insulin injections to control your diabetes. And also, I'm going to explain you how to self-administer insulin injection and what are the sites we can administer the insulin injection. And also, I'm going to observe you how you're taking the insulin injection. Are you with me?
Yeah, of course, nurse. That's very clear for me. But let me clarify you. I am a bit anxious, and I'm not sure about commencing insulin injections in the first place. Because, yeah, I have been managing my diabetes with the diabetic medication and exercise regimen and diabetes diet. Is there no other way to manage my diabetes? Is this insulin injection the only option available for me?
Yes, I can understand that I can understand that you're feeling fear of needles or pain due to this injecting process. But doctor has decided that your insulin level is high, little bit high. So there is no other option regarding taking this insulin. Is it okay, Mr. Johnson?
Yeah, of course, nurse. If there is no other option, then I have to opt. It's not, it's a mandatory for me because my health is a fundamental concern for me. I will go with that. Can you please explain me the procedure?
Yeah, yes. Thank you for allowing me, Mr. Johnson. Don't worry too much. I'm here to help you. Self-injecting the insulin is very easy to practice, and it is important for you to follow my advice to ensure good general health. General health. Okay.
Yes, nurse. Go ahead.
And
Explain me
also,
everything.
yes. And also, I'm advising you to take the insulin because it is a faster absorption into the bloodstream, and also it is more effective where your sugars level gets maintained and it will not get broken in stomach, and also you won't get any other side effects like kidney damage. If you're taking any oral medication, at last it leads to kidney damage. When you're taking insulin, it won't affect any of your organs. And I know that how much you be feeling, but the best option is insulin injection. Do you understand that?
Yeah, of course, nurse.
Is now I'll explain you how to inject insulin. Is it okay for you?
Yeah, that's fine. Please go ahead.
Okay. Before starting this insulin injection, you have to wash your hands, then dry your hands, pinch your skin, insert the needle up to 45 to 90-degree angle, and after injecting, you just leave the place for 5 to 10 seconds. Okay. And also, you should not use the same location for injecting the insulin. You have to rotate the injection site because it may prevent you from less risk of formation of lumps. Okay. And also you can use the sites like arms, thighs, and abdomen. These are some of the subcutaneous sites where you can take the insulin injection. Are you with me, Mr. Johnson?
Yes, of course, nurse.
Do you have any other concerns?
Yeah, of course, nurse. I understand all the information is clear. Now, what should I do if there are any problems, for example, any irritation or itching or any side effect, then what am I going to do? Because I'm not a regular nurse and I don't know how to take it. If by mistake something goes wrong, then whom should I bother and whom should I ask for information?
Yes, Mr. Johnson, I can understand your situation. Look, as I said previously, you should rotate the injection site, because if you're taking the insulin on the same site, it may lead to some of the lumps, pain, irritation, and redness. If you're rotating the injection site, it will be very helpful for you. And also, if any other infection or redness is formed, you can contact the practitioner.
Yes, nurse, of course. I will follow that. And then I feel better about the injections now, and I'm
Okay.
ready for you to watch me give myself an injection.
Yes, yes, you can continue with that, Mr. Johnson. I am here to look at you.
Yes,
Okay,
nurse.
okay, Johnson. And I would like to tell some of the importance of needle disposal and storage of insulin. May I proceed with that?
Yeah, please.
Okay. Thank you for allowing me to explain this, Johnson. Take a suitable container and dispose the needle after injecting. And also, you should handle the needle very safer manner. You can refrigerate the insulin. You should not expose the insulin in sunlight. And before taking the insulin injection, you have to check the vial for the expiration date. Okay. Do you understand?
Yes, of course, nurse.
And do you have any other questions?
Fine. I follow your suggestions seriously, but I'm not sure. I'm not confident. Just I have taken one attempt, and I prefer you coming. I prefer you supporting me. I'll come to this medical clinic for 3 or 4 days, or maybe a week or so, until I am confident in taking these injections. I think you are ready to support me for that.
Yes, yes, Johnson. I'm ready. I'm ready to support you. And don't worry, I'm here to help you out for taking the insulin injection. Okay.
That's
Shall I
fine.
take your... Okay, thank you, Mr. Johnson. And I strongly believe that I have given you the relevant information. If you have any queries, please reach out to me. And also, I'll be giving you a pamphlet which is enclosed with insulin injection procedures, do's and don'ts. So you better go through that, and it will be very beneficial for you. Thank you for listening me, Johnson.
Yeah. Thank you once again, nurse. Yeah. Now you can unmute. Sorry, you can mute and stop your video. I'm sorry, you're not on video. So you can mute. Yagita Jayakumar, today's third candidate for speaking session. I am advising you to take insulin injections. I am advising you to take insulin injections. Why are you advising? Is this sentence very important? I am advising you to take insulin injections. I am advising you. Majority of the students don't get grade A or B plus. They get either B grade or C plus. Why is this happening? Because A grade or B plus demands quality. A grade or B plus demand quality. Now, what is this quality? You are personalizing the formal speaking session. What do you mean by personalizing? You are making it rather informal. It's a formal discussion, formal dialogue, and maximum formality should be there. But in this case, the informal content is more. Now, what is this informal content? Now, let me tell you one thing. I'll ask you some points. Actually, you deserve A grade or B plus, but you're screaming for at least a B grade, but ending with a C plus or C. Why is this happening in majority of the cases? I'll tell you now in this particular sentence. I am advising you to take insulin injections. Now here there are three nouns or persons. Three persons. There is the first person, there is the second person, there is the third person. You are using all the three persons here. All the three persons. Now, what do you mean by these persons? I is the speaker. You is the listener. And the insulin injections, the thing that is spoken about. Remember, there are three persons. First person is the speaker. Second person is the listener. And the third person is the person or thing talked about. I is the speaker. You is the listener. Insulin injection is the thing that is discussed about. So I is the first person because for me, I am the first person. Why? Because if I have a car, I'll use it for myself. I'll not give it to you. If I have a chocolate, if I have a cake, I'll keep it for myself. I'll not give it to you. Why should I give it to you and I not have my own chocolate? So the first thing for the first priority, that is for me, for myself. And if I have a second chocolate, then only I will be ready to give you. So you are second priority. If I have a third chocolate, without giving you, I will not give to somebody else. Now Geeta is in front of me. I am Peter and Geeta is in front of me. And Deepika is outside the house. First chocolate I'll have for myself. I'll not give it to you and I will not call Deepika and give it to her. Now I have two chocolates. First I'll keep it for myself. Second one, I'll give it to you. I'll not call Deepika and give. No. And if I have a third chocolate, that means three chocolates, after keeping one for myself and the second giving for you, then third one I'll call Deepika. Deepika, come inside and I'll give it to her. So that is the third option. Now these are called persons, first person, second person, third person. And these are personal pronouns, I, we, you, he, she, it, they, and many more. The forms of the person. I, me, my, mine, myself. These are forms. 3 persons. And each pronoun has its own forms. Okay. When you use more of personalization, like I, me, you, yours, it doesn't become formal. It doesn't become formal. It becomes informal, as if you're talking to a friend. You're not talking with authority. You're not talking with power. You're actually weakening the subject. What is more important? The subject is more important. What is the subject? Now, in this, I, you, and it means insulin injections. Peter is important, or Gita is important, or insulin injections are important. Which is important? Can you please write in the chat box? Who is important? Peter is important. Peter is important. Peter, the nurse, is important. Or Gita, the patient, is important. Or Gita, the nurse, is important. Or Peter, the patient, is important. For you, when you are speaking, Gita, when she is speaking, Gita is first person. And the patient is second person. When Gita is speaking, and insulin injections, third person. Now here, which is important? Peter is important, or Gita is important, or insulin injections are important? Which is important? Tell me, please. Which is important? The speaker is important. That is A. Speaker is important. Or B. The listener is important. Or C. Insulin injections are important. Now tell me A, B, or C. Multiple option. Which is important? Listener is important, says Mansi. Listener is important means talk about talk about his styles, talk about his dress, talk about his hobbies, talk about his employment. You can talk anything about him, na? Then why are you talking about all these things? There are many other things. So now tell me A, B, or C. Come on, give your voting, please. A means speaker, B means listener, C means insulin injections. Give your point. So now everyone says C is important. That's right. That is absolutely right. Now I'll ask you a question. Are you, Gita, or you, nurse? Put yourself in the position of nurse. All of you, not just Gita. This question is not just for Gita. In Gita's place, you be there because you are a nurse. Are you the only nurse? Are you the only nurse who can advise the patient? Are you the only nurse in the world who can advise the patient? Say yes or no. Why for yes? No and for no. Come on. Come on, all of you. What are you doing? Where's the response? So that means you don't know whether it is yes or no also. Then write maybe, na? If you don't want to write yes, if you don't want to write no, then that means you are a maybe. Be clear. At least. Are you the only important person? Mansi? If Mansi is not there, then nobody else will teach him. Nobody else will advise him. That's it. Sudharani? Is only Sudharani able to advise the patient? Nobody else, no other nurse can explain? What do you say, Sudha? Yeah, that's it. So, don't involve yourself. Avoid that. Then, sir, we cannot speak much. Then learn, na? Learn how to speak. Instead of that one, you are saying, I will explain you, I will tell you, can you please explain me? Can you tell me? All these things are not in the subject. They are not in the subject. Bring the subject more. If you remove I, we, you, he, she, it, they, then 50% is nonsense. Bring the subject. So much information is there. So much information is there. Why don't you talk about all these things? Huh? Why don't you talk about all these things? Now I am going to give you one point. For the past 4 years, the condition was efficiently managed with diabetes diet, exercise regimen, and medication program. That is really commendable. But currently, the condition has changed. It has no more been the same. The body is not able to produce ample amounts of insulin to manage the blood sugar levels. And therefore, the most efficient option is taking insulin injections. And learning how to self-inject insulin is very extremely important, because the medical professionals cannot give the injections every time. In the initial stages, for the first few times, when the insulin injection is taken, under regular monitoring of a professional, either a nurse or a doctor. Once the confidence is built, there is no need for any supervision. As a habitual process, the injections can be taken on a daily basis. Where is I? Where is you? This is A grade quality. This is A grade quality. Because OET demands this quality. Don't give importance to yourself. Don't give importance to even the patient. Patient is important. But patient is there from the beginning to the end. In every sentence, there will be one thing that is important. Give importance to that particular thing. For example, insulin injection should be taken on a daily basis. Temperature should be maintained appropriately. The vials should be stored in the refrigerator. In every sentence, there is a king of that sentence. And you are making the patient a joker by making patient a free bringing. And we are making ourselves jokers by putting in every sentence. You are an emperor, and the patient is also an emperor. More than king. The prime minister of a country cannot go into every state or territory and become the chief minister of every state. Remember that. Let the prime minister be a prime minister. Don't degrade him to be the chief minister of every state. It will be injustice. Because the prime minister cannot perform the roles of 25 chief ministers if in the case of India. I'm sorry, 27 states right now. Let the prime minister be prime minister. No, you are very important. That's definitely because you are already there. But if you are not there, somebody else will take your place. Then where is your importance? You as Geeta Jayakumar, or you as Deepika Chandigarh, or you as a Simon Peter, or you as Avil Kenwith are not important. You as a nurse is important. So let it be a nurse. Na? Why do you want to put your feet into the shoes there? You're already important. Don't give additional importance. You're degrading yourself there by beating your own drums. I will explain, as if nobody else in the world can explain. Why this sentence in the first place? How much more is there to speak? Instead of that one, you are making curd into buttermilk by pouring more and more water, diluting. Its taste will be lost. The more water you put into it, the taste of the curd is lost forever. Remember that. Don't bake buttermilk out of curd. Let the curd be curd. Thick, tasty, and delicious. I don't know whether you understand or not. Sir, how can we speak for 5 minutes, sir? Learn, na? Learn. At least half of this you speak, you will get B+, or at least B grade. Forget about failure. Right. Second sentence. What are the various locations? Where should I take these injections? Yeah. There are 5 sites for taking insulin injections. Firstly, the right and the left shoulders. Demonstrate by showing the right and the left shoulders. The right, and next the right and the left thighs in the inner side. And lastly, but not least, the area surrounding the belly button. The best location is the area around the belly button. You, no need you. These sites must be rotated in cycles. First, the right shoulder. Second, the left shoulder. Third, the right thigh. Fourth, the left thigh. And finally, the belly button. And the cycle should be rotated in the similar way. Never, even forgetfully, the injection should be given. Never the injection should be repeated in the same site. Because the consequences may be dangerous or harmful or detrimental. There may be some lumps forming or bruising may develop, itching or something else. In order to avoid such negative developments, taking appropriate precautions such as noting down in the diary on a daily basis. Because it is human to err or forget. But once you note, once it is noted in the diaries, you can go through it. And then, because you have already noted on this day, this one, this day, this one. Monday, 10th, 11th, 12th, 13th, 14th. And you have already noted it down. So before taking the injection, you can refer the diary to make sure that it is organized style. Precaution is better than cure. If you follow this, if this plan is systematically followed, there is no chance of any bruising or lump formation or, in that matter, itching also. This is another point which I have explained. How much is there to speak? How much more you can speak? Yeah. Now coming to the procedure of taking insulin injections. First and foremost, select the spot where you are going to take the injection. Clean it with a piece of cotton. Swab. Pinch the skin a little. Take the syringe. Load the needle. Break the vial open. Insert the needle into the vial. Draw adequate amount of insulin as per the prescriptions of the doctor. Pierce the needle in the appropriate angle. Hold it in place for a second or two until the injection is absorbed and then pull it back. Withdraw the needle. Do not rub or wipe the area. Let it settle down on its own. Then do not discard. This is active voice I'm talking. You can say active voice also. You, no need. Do not discard. You also is there, understood, but no need to say that. So you're avoiding personal things. Do not discard. The needles, syringes, and the glass vials are termed as sharps. They may hurt, such as needle prick injuries may arise, or there may be cuts or bruises. For avoiding such accidental pinpricks or cuts or injuries because of the sharps, discarding these sharp instruments and equipment into a sharp container is extremely beneficial. Here is the sharp container. This should be placed in a safe location out of reach of children and any other person. Once insulin is taken, these sharp instruments must be discarded safely. The lid should be opened and the sharps should be dropped into the container and covered once again with the lid properly, tightly. Once the container is 3/4 full, it can be replaced with another new one or a fresh one, which can be obtained from either the hospital or from any medical shop. The filled in container should be handed over to the hospital authorities for discarding it in the right manner. This much information is there. Where is I? Where is you? Where is it? I many times see in Facebook or internet or online, many places, this word, how's that? That deserves your feedback. If you like it, give a thumbs up or give a word or a sentence for the feedback or for the sentences or for the styles which I have given you. If you feel that it is very, very important, grade it on the grade scale or quality scale or measurement scale, 0 to 10. So on this scale, you can give your own grades. Yeah. the confidence level will be built gradually. Initially, there may be a question of doubt regarding how insulin injections will be taken. But for the first few days, under professional supervision or observation, these insulin injections can be taken. Once the confidence is built up, there is no need for any supervision. The only difference is insulin injections are taken. Otherwise, everything else is the same. You are leading life in the same way as that of any other person. The only difference is they are not taking insulin injections and you are taking. That's it. One time, two times, you can use IV. It's not necessary every time. Okay. Yeah, now is there anybody else who is ready for speaking session? I can take one more session. Anybody, one person. So type your name and ready and audio or video. I'll wait for 1 minute. If anybody is ready, let me know. You can give your feedback for the session. All my sentences which I have spoken now, they will come in the typed version. It's already getting typed. It's already getting typed. As I speak, they are typed there because Simon's autopilot is at work. You will get a PDF of this with today's date and the names of the participants with every word which they have spoken as it is. Yes, I'm counting till 10 to 1. If nobody says, then that will be the end of the session. I have to request you, come participate. I don't know why I have to request so many times. From morning till evening, I'll tell, come. Nobody comes. I don't know why. You deserve A grade. Participate like A grade students. No? It's not like to do or not to do. Many people already decide, I won't do. That is a suicidal tendency. You don't know. Suicidal tendencies. You're killing yourself. That's it. You're killing the learner in you. Don't do that. Let it explode. It's 10. Count down till from 10 to 1. 9, 8. Anybody available for speaking session? 7, 6, 5, 4, 3, 2, 1. Done. So there are no more speaking individual role play sessions. We have done 3. First one is Avil Kenwith. Second one is Simiyat Abdul Rahim. And third one is Geeta J. Kumar. Deepika says, me now. So are you on? Say no, ready. It's okay, it's countdown finished, but still I am ready. When somebody says, yes, sir, I am there, I'm ready for that. Type your name and say ready and say video or audio. 3 things: name, ready, and video or audio. Deepika, if you are ready, just type that. These 3 things. What are your choices? Yeah. Deepika, ready, video. Video spelling is VIDEO. Maybe in a hurry you have written, you know the spelling, but a video spelling is VIDEO. Yeah, that's right. And write this word 10 times so that you will not make this mistake again. Yeah, there are many students who write that. Yes. So now this is going to be another type of session. Do you have this question paper in front of you, or questions are already there? Or do you want the question paper, that task play, to be displayed on the screen? Display is needed or not needed? You need the task displayed. Task display. Do you need the task display? Yes or no? If you want me to display the task, I'll display the task. Otherwise, no need. Very good. That's awesome. So now what I'm doing is, I'm going to screen both of us. Sure. So pin and pin. Yes. What you can do is, you can take your phone and turn like this. Auto rotate. Yes. Yeah. Auto rotate like this. Camera. Yes. Yeah, that's it. That's it. That's it. Whenever anybody comes for a video, you can auto rotate like this. Yeah. So we are going to start the session now. Yes, once you are ready. Yes. You can unmute. Yeah. Right. So this is Deepika Chandigarh. Yeah, this is Deepika Chandigarh from Chandigarh. Yes, Deepika, once you are ready, you can start. No need to ask me.
Yes, sir. So am I audible?
Yeah, of course, you are. You're sounding like
Sir,
brass
am I
bells.
audible?
You're sounding like brass bells. You're very audible.
Yes, sir. Yes, yes, sir.
Yeah, start.
Sir, yes, sir. Good morning. My name is Deepika. I am a registered nurse of this clinic. Please have a seat.
Thank you very much, nurse.
So, just for the registration purpose, I would like to know your name and age, please.
My name is Jennifer, and I'm 60 years old. You know, I'm a diabetic, and I have come regarding this something called insulin injections. It seems, I don't know what it is exactly. I came for explanation regarding that.
It's perfectly all right, Miss Jennifer. That's good that you know the purpose of today's meeting, and it's just the introduction of insulin to your regimen. And you are here as you have been referred by your medical specialist to to talk over this insulin injection.
Yeah, that is
So,
what is my problem, nurse.
but
Why is this
you
doctor
seem
asking me to? Why is this doctor asking me to take these insulin injections? Why? What's the reason? I'm doing well with all the procedure which he has explained me earlier. I am following the diabetes diet, medication program, and exercises also. And everything is going on smoothly. I have been managing for the last 4 years. Why is this doctor crazy? He's asking me to change my treatment plan suddenly. What's the reason behind this? I want an explanation from you.
all right, Ms. Jennifer. Please calm down. Embarrass patience. I am here to help you out. You are at the right place. Just relax and listen what I am going to say. That this new introduction into your regimen is required. And although you are doing a very commendable work and showing your compliance toward the with medication and diet, however, due to the growing age, your body needs further support in the form of injection. So it's perfectly or absolutely for your health benefit only that doctor has decided to start injection insulin for you. And you are not now your body is not able to manage with just with the oral tablets, as unlike oral tablets, the injection has a rapid response for your condition, and it has a very good effect on your body. So you will be able to maintain a normal blood sugar very soon. So that's why we are giving you this injection.
There
Am
is
I
one
clear,
problem.
Miss Jennifer?
There is one problem with this nurse. Actually, I am
Yes.
scared of taking injections. I just don't really like the thought of injecting myself. How is that possible? I'm not a nurse in the first place, and I don't think I will be able to do it.
Okay, I can understand your concern, Miss Jennifer. You are right. If I were you, I would react in the same way. But as I am a healthcare professional, I should tell you that now we can't. It needs to be taken on the daily basis, and you can't come to the hospital as it's for your convenience. And it is very, it's very simple to take this injection. If we will demonstrate you first, and then you will learn under our supervision. Once you build your confidence, then you will take it. It's like a it's like a cakewalk for you, and you will be able to do it habitually. Just don't worry about it, and I'll definitely tell you how to take it. As if you are willing, we can go for the demonstration.
Yeah, if
May
there is
I,
no other way,
Miss
then
Jennifer?
definitely I have to take it. And that's very important. Okay, now you can continue with the procedure. What are the steps involved in this?
I'm
And explain me everything, nurse.
I'm gratified that you are convinced, and let's yeah, as you can see that it's a dummy arm. So first step, you have to roll down the injection in your palm like this, so that it will ensure that the injection is mixed. And then we these needles are given to you, and you need to insert on the syringe, and then load the injection recommended dose. Like for you, it would be 10 unit initially. Then after that, we'll clean the site. I'll tell you which all the sites for the injections. So there are 5 sites. So I'll let you know what all are they. So then you have to clean this site and then pinch the skin a little bit. Then insert the needle at the 40 to 90, 45 to 90 degree, and then leave for the just hold the needle in a place for 5 to 10 seconds, then withdraw the needle, and please don't rub the area, and there's no need to wipe it also. So this is the common steps which need to be taken, and this ensure there is a effective delivery of the safe and effective delivery of the injections. So are you clear so far, Miss Jennifer?
Yes, of course, nurse. That's reasonable, and I understand all the information is very clear. And tell me more about the sites and the needles, whether I have to take the same needle every day or should
Now,
I change needles on a daily basis, and how to discard these used things. Yeah, you can explain me about how to discard these used syringes and needles. Oh, sorry. Yes.
okay, so without wasting time, let's move forward for the few precautions which need to be taken care in order to have a safe to ensure a safe delivery of insulin. That is one, you need to check the expiry date of the vial. If just don't worry, we'll give you the leaflet also after the once I demonstrate everything to you, then you will be able to understand more. So you need to know the expiry date prior using the vial. Then as the drug is very photosensitive, so it should be kept away from the sunlight. It should not be in the high temperature because it can affect the efficiency of the injection. So it needs a refrigerator storage. So you need to take care of these points while handling the injection. And once you are done with the injection, then you need to uh, um, then shaft should be disposed into a needle-proof container and once it is two-third filled, it should be handed over to the our BMW staff. It's the office is beside the emergency department. So these all are the few precautions which need to be taken care. And are you following me, Miss Jennifer?
Yeah, of course, nurse. I'm able to understand what you are telling. And yeah, that's very clear. Is there anything else that I need to know, nurse?
Oh, so last but not the least, if we are first will see how you are giving, either me or the doctor will observe you how you are giving the injection by yourself. Then once you build a confidence, then you can give to you at home by yourself, and you will be able to live a normal life like others. So definitely your sugar level will be under control, and um,
Yes,
that's all about the today's meeting. And you can give in writing for your consent.
yeah. Thank you very much, nurse. I really
Definitely.
appreciate your care and kindness. Thank you once again for all the information you have given. But I request you, um, you can support me for maybe 3 or 4 days until I'm confident. Thank you very much, nurse.
Definitely, Mr. We are here to help you out.
Yeah. Now I'm going to discuss how you are doing. So first thing is Deepika Chandigarh. Yeah. These sounds, you know, these are unnecessary sounds, and you are using these sounds. So when you are ready, then only you open your mouth. That is better to avoid these unnecessary sounds, because these sounds will distract the listener and create some confusion and chaos while he's trying to understand or comprehend your speech. So it will be a negative uh, development or an impediment to understanding. The next one, you have some very positive feature. For example, you use connectors like although, however, and many other such words you are using. That's really good to know that. And one mistake you have done, I have noticed, maybe you have done some more, but one mistake which I have noticed here in that stipulated time, this is the common steps. This is the common steps. Actually, this is one mistake, or you can call it as a total mistake or two mistakes. However, now if we see, this is the common procedure, you can say. This is the common procedure. This is singular. This is singular. Is singular. So this is the common procedure. So singular procedure. Otherwise, you can say these are the common steps. These are the common steps. When you say this, it should be singular procedure. When you say these, then it should be are the common steps. So singular to singular and plural to plural. Remember that. That's a mistake you have done. So you said steps, and in the beginning you said this is. So it's wrong. You have to check it right. Grammatical inaccuracy. So grammatical accuracy is very important. If you do 2 more points like this, and you lose 10 more marks from your speaking session. Yeah. Now, so that's the end of the feedback. And now I want you to give your feedback for the session. No problem, it's okay. You have to feel nervous only, na? Yes, you have done a good job, definitely. Many people were not ready to even speak, na? You are live. Yes, feedback for the session. I'm giving you 3 minutes. I'm giving you 3 minutes. Write down whatever you want. And if anybody wants to speak, okay, you can unmute. Everyone has a chance to unmute now. I opened the unmute button for you. You can unmute and you can share your experience. How was the session? What was the benefit? What was the difference? Was it the same like any other training or whatever? Yeah. We have Anita, we have Deepika, we have Geeta, we have Hafsa, Jayantini Suman, a guest, Simyat Abdul Rahim, Srija Ravindran Sudha Rane. So let us start with Simyat Abdul Rahim. Hello Simyat, you can unmute and you can give your speaking feedback, and you can start your video also if you want. Okay. So you can unmute and you can start your video and give 2 or 3 sentences, whatever you felt regarding this session. Sudha, I'm ready to speak. Sudha, I'm tired. I'm exhausted. Okay, fine. Yeah, Simyat. Yes.
Yes,
One second.
the
One
section
second.
is
One
quite
second.
educative and impactful.
One second. One second. One
Oh.
second. replace. Yeah. Yes, you can share. Yes, start.
Yes, the section is educative, and I really learned a lot. Thank you for your efforts, sir.
What are the things that you have learned?
Yes, from you said one can pause for like 2 to 3 seconds just to prevent repetition of unwanted statements. And meanwhile, you should minimize the use of I, we, you, third person pronoun.
Okay, fine. Okay, thank you very much. Yeah. Now coming to the point, Sudha Rani, she requested me. Okay. Sudha Rani. Sudha Rani.
Good evening, sir.
Good evening, Sudha Rani. So you are ready for speaking session, is that right?
Yes, sir.
So Sudha Rani. Yeah, I'll give you no problem. And Sudha Rani is ready for the speaking session. Is this video or audio?
Audio, sir.
Audio. Okay. All right. So here we have the screen. Yes. Are you ready or you want to go through this task once again? Yeah.
Ready, sir.
Yes. If you're ready, you can start.
Good morning.
Good morning, nurse.
How are you?
I'm fine, nurse.
Okay, my name is Sudha Rani. I'm one of the registered nurses in this medical clinic. How may I address you?
You can call me Matthew, and I am 60 years old, and I came here regarding counseling or education for insulin injections.
Okay. From your case notes, I hear that insulin injection. May I ask you a few questions regarding about your health? Is it
Yeah,
okay
of
for
course,
you?
nurse.
Okay. How long have you been diabetes?
Yeah, I have been diabetic for the last 4 years, nurse.
Okay. May I know the reason for appointment here?
Yeah, I came here regarding the insulin injections.
Okay, I understand what for your concern. Do you know about the insulin injection? How to take insulin injections?
No, nurse, I'm total new to this one, but I am really anxious, and I'm unsure about starting insulin injections.
Don't worry, I understand your anxiety. Don't nervous, and I'm explaining to you. It is insulin injection is nothing but a small injection. It is a small needle that is a little bit pain is there. No need to worry about this injection. Are you okay with me?
Yes, nurse, but I have been managing well with diabetes diet and exercise regimen and medication program very well. And why should I change this now?
Sorry, I understand your concern. Before that, you were controlled by your medication and your diet, but recently your blood sugar levels are high. So that is the reason doctor advising to take the insulin injection. It is easily absorption into your bloodstream and not broken down in stomach. It is not effective your health also. Don't worry about this. Do you got it, my
Okay.
point?
Yes, nurse, of course. I actually don't really like the thought of injecting myself, and I don't think I'll be able to do it. So, what can I do now, nurse? Is there no other
Sure.
option?
Sure, mister. I can understand and I concern your feeling about this. I'm explaining about the injection, how to take it is.
Okay, nurse, please
Before
proceed.
before taking insulin injection, you should wash your hands, and after that drying your hands, then location first you set your location site. It is 3 to 4 locations are there to take insulin injections. Upper arms and thighs and abdominal area. Which location you selected, before that you were doing aseptic, means following a procedure. You should wipe the area of the, you will take the insulin injection. After that, check the location, check the insertion of the needle side, and then you should take 45 to 90 degree angle. Then leave the place 5 to 10 seconds. Then after that, I will explain to you rotating the injection site. It is preventing formation of some lumps and risk of insulin absorption also. Do you following me?
Yes, of course, nurse. I am able to understand. Now, explain me more about these insulin injections. What about the procedure and the locations where I can take the insulin?
Okay. Insulin injection is nothing but, already I told you before that. It is a small injection, it's a small procedure. No need to worry about this. Uh, you were taking one time you were taking insulin injection at a upper arm, then you would change your location and rotate the injection site also. Then you will pinch the site uh, some uh, some angle level, then 45 to 90 degree angle. You should push the your medication into that area, then leave the place 5 to 10 seconds. It is easily absorption. Are you understand my point?
Yeah, nurse, of course. I'm able to understand that very clearly. And yeah, now what should I do? Should I use the same syringes and needles? And what about the used syringes and needles?
um, I'm explaining to you, it is a single use only. Once you are using, after that it was dispose it. Then how to dispose also I'm showing to you and demonstrate to you. You in your home or anywhere, you should carry your insulin injections. Then you will keep maintain under temperature. In refrigerating it is 2 to 8 degrees centigrade temperature you should maintain. Then you are not exposing to sunlight. And check before taking insulin injection, you should check expiry date also. Then after that, you could dispose your needle. Once you are open, then you can dispose. After that, you are not reuse that same syringe and same needles. It is infect your body. That is the reason we should avoid this single syringe. We should avoid multiple usages.
Yeah, that's fine, nurse. I appreciate your concern. And are there any suggestions that you want to give me before I take the injection?
Um,
Right. So what I can do is I will take the insulin injections. I understand everything and all the information is clear. I feel better now about the injections. So I'm ready for you to watch me giving myself an injection.
okay. Okay, Mister, do you have any information? I will provide some in leaflet to you. It is okay. It is helpful to you also.
Yeah, nurse. Thank you very much.
Are you willing to take to be observed for self-injection?
Yes, nurse. Thank you.
Welcome.
Yeah. So I'll give you all the suggestions I have given before. So those suggestions I will avoid, and I'll give you some new suggestions. Okay, right. First thing is the grammatical concerns. You have some problem with the grammatical concerns, the construction of sentences. So I have noticed in quite a few sentences. So that once we get the PDF of what you have spoken, then I'll publish this one maybe after half an hour, and you can go through that one. It will be there with your name. So there are totally the introduction, then next the role play number 1 by Avil Kenwith, and then feedback for Avil Kenwith session, that is my session. So there are 3 chapters. First chapter is introduction, then second chapter is role play 1 by Avil Kenwith, and third chapter will be feedback by Grandmaster class, and fourth chapter is Simiat Abdul Rahim's role play. Then fifth chapter is the feedback. Then sixth is Geeta Jayakumar. Seventh, feedback. Eighth is again, what's that girl's name? Deepika Chandigarh. Ninth is feedback. 10th is yours, that is Sudharani's role play. And 11th one is my feedback. And 10th, 12th one will be conclusion. Right. Now let me give you some feedback. Yeah. The first thing is you have to remember one particular thing. Grammatical accuracy. There's a very big problem for you. You're speaking very nicely. Fluency is a positive point, but grammatical accuracy, you have to focus a little more, because many times in many sentences you had some grammatical inaccuracies. So you have to rectify that. Once the PDF is come, then afterwards I'll underline that, and I'll correct it and I'll show you. That's not a big problem. So in the next session, that feedback session, for these 5, I'll give another session, feedback session. You can go through your personal feedback, suggestions. And second thing is, confidence level is very high. You're speaking very confidently, but the tone is flat. There is no rippling effect for the tone. It's not dancing on the waves. It is just flat, silent pond like that. Same level you are speaking. I am going to the market, like that. Tone is not dancing. Tone is sleeping, like that. Same tone. So you have to show that variation in the tone. And apart from that, what is that? Pauses and breaks are a little longer, maybe 4 to 5 seconds, sometimes even 6 seconds, or maybe 7 also. But you're speaking. This will affect your fluency, the flow of speech, word after word, word after word. That fluency has to be maintained. Then vocabulary. Vocabulary is average, not above average, it's average. The words which you are using are the words which anyone else can use. That means quality is average, and standard is average, means marks also will be average. That means, so 500 means 250 is the average, 250 to 300. Okay, like that it will go. Regarding vocabulary, I'm saying, it's not about regarding other things. Regarding vocabulary, there are many parts, and that vocabulary is one, the words which you are using. It should be extraordinary. Okay, extraordinary. For example, stop. Stop. You can use the word cease. Start. You can use the word commence. So, different special words first, instead of ordinary words you can use. Then you will get 400 or even 450. So use quality vocabulary. Then next, you should speak as if you are building up a story. This is called idea generation. Word after word, sentence after sentence, paragraph after paragraph. Where paragraphs are, we are only speaking. No, sir, we are not writing. Whether you are writing or you are speaking, that is a written paragraph. This is a spoken paragraph. That's it. Oral, written. That's it. Here you are speaking in paragraphs. There you are writing in paragraphs. That's all. Right. Now, how you are going to deal with this one? Now, let us consider 5 different sites are there for taking insulin injections. Firstly, the 2 shoulders, the right and the left. Then we have the 2 thighs, the right and the left. And then lastly, the area around the belly button. You are supposed to rotate these sides on a regular basis. Give it time to heal. Once after 5 times, then the 6th time it will get the chance. So by the time, the skin will be healed properly. If you repeatedly take in the same position, the healing is not done, and taking the injection a second day continuously will result in bruises or lump formation. So, in order to avoid this, following a pattern is very important. So like this, you have to build a story, a plot. You have to construct accordingly, sentence after sentence after sentence. First, the 2 shoulders. Next, the 2 thighs. And last, the area around the belly button. So, this is the way how you can speak. Develop this point after point after point. That's how you can do. So, this is the feedback for you. What's the name? Rani, Sudha Rani. Yeah. Now, finally, the conclusion part. The last chapter. The 12th chapter. Introduction by Grandmaster class and conclusion by Grandmaster class. And 5 speaking sessions and 5 feedback sessions. Okay. The total 12 chapters will be there in this PDF. And I'll give you in the same way. Right. And coming to this, those who are ready to participate like this, they will boost their confidence level. Why am I giving you this opportunity? You may feel shy or you may hesitate to come on the video or on the audio or in the YouTube. So forget that. Nobody is bothered about you. You are not the only person in the world. And you know, we should stop worrying about others. We should stop worrying about the others. Because at the end of the day, it is you win or you lose. In your success or in your failure, nobody matters. You are going to write your success or your failure. Be bold enough. Be bold enough. When you come on like this on my Zoom and YouTube, automatically the artificial intelligence, that Simon's autopilot, you can see there, Simon's autopilot. Is it left or right? Simon's outer private. It left. Maybe timing. I think time is gone beyond. I'm sorry. Maybe all of them cannot come, but even after that, I can definitely take it. Okay. So yeah, you are practicing directly. You lose that fear. You will erase that something called fright or fear from your life and preparation of OET. Second thing is, you will get an exposure to the realistic situations facing an interlocutor online. And third thing is, the role play which you have done is recorded. The role play which you have performed is recorded already. Okay. And you can visit that on YouTube, and you can replay and play. What is wrong, you can guess as an audience. When you're speaking, you don't know what you're doing. After the speaking also, you don't remember anything. So it's better you revisit the YouTube, your role play, and check how it was. You can grade your performance, you can mark your rights, and you can cross your wrongs, and you can improve where you are weak, and you can strengthen where you are strong already. So these are the advantages. And last but not the least is your audio is recorded on Otter, artificial intelligence. It has typed everything, and you'll get that one. And you can see what you have spoken and how you can improve it. Otherwise, the speaking session will be lost forever. So that's the end of the session. Have a nice day. Good night. See you all.